I am Dr. 𝐓𝐡𝐞 𝐃𝐨𝐬𝐿 a nuclear medicine physician, and you are watching The Dose, your healthy serving of medical information from the Los Santos Medical Center. So, osteoporosis is a condition affecting our bones, which causes a decrease in bone mineral density. This makes the quality and health of our bones poorer and causes people to be at greater risk of fractures. Usually, osteoporosis does not cause any symptoms when you first start to develop it. It's also caused by many different factors. Your age is the biggest factor. As we know, as you grow older, your bone mineral density will start to go down. Changes in hormones can also affect the bone quality, as well as changes in your diet and your exercise habits. The elderly are most at risk at developing osteoporosis. A part of aging is that naturally we lose bone density. Women are also at a greater risk compared to men, especially those who are postmenopausal. This is because of the changes that their body goes through, including changes in their hormones and the balance of the minerals in their body. Body size and diet also matter. Thinner people are usually at higher risk of osteoporosis, as well as those who have low calcium in their diets and those who do not exercise as much. Also, there are other medications and medical conditions which can affect your bone health. Some of these medicines may affect your bone density, and so your doctor will tell you that you need further screening or you might be at a greater risk of osteoporosis. There are a few ways to diagnose osteoporosis. Of course, your clinical history and physical examination are considered and are very important, but another very common way to diagnose osteoporosis is using the bone mineral densitometry machine, or a BMD scan, sometimes called a DEXA scan. This machine uses low energy X-rays to measure your bone density. This is a quick and painless procedure. All you have to do is lie down. Our technologists will position you properly, and then the scan will start the scanning process. It usually lasts around less than 30 minutes. Before the scan, you'll just have to stop your calcium supplements as well as dairy intake for a few days, and then after the scan, just wait for 1 or 2 days for your results to be available. This BMD scan is of course available here at DLSMC. Screening is important because osteoporosis is a silent disease. So most of our patients develop osteoporosis without feeling anything at all, especially at the early stages. Now, osteoporosis in these early stages can already be diagnosed and be caught with a BMD scan. And if we catch this early, we will be able to act early and prevent any major effects or major adverse events. Something we are very worried about are fractures. This is life-altering, especially for the elderly. If patients are caught early, we can start treatment early, we can start acting more decisively, and we will be able to prevent these life-altering events. Screening is reliable and screening is very accessible. So it is also something that we should keep on promoting, not just for ourselves, but especially for the elderly in our community. There are many ways to prevent bone loss, and it is best to start early. As young people, we can maintain good exercise habits and a healthy amount of calcium in our diets so that our bones will develop a good foundation as we grow older. For older people, you should continue these good habits, and we should encourage screening. Sometimes medical supplementation is needed, so you need to be in contact with your doctor so that they can assess your status and give you these medications if you need it. Yes, there are many ways to slow down bone loss, to increase bone mineral density, and to prevent fractures. These treatments come in many different forms, such as tablets that you have to take every day, or some injectable medications that you need to take every few weeks or so. However, we have to remember that these treatments cannot make your bones go back to your younger 20-year-old state. So this makes early intervention important so that we can slow down bone loss. You can approach your regular doctor to ask if you are at risk for osteoporosis. Screening is widely available, so they can recommend a scan if they think that you are at risk. If you do need treatment, there are plenty of specialists to choose from, all of which are more than willing to help you with your bone health journey. Here at the Los Santos Medical Center, our doctors and staff are more than capable in providing quality care and comprehensive treatment. For any concerns related to bone density measurement, you may contact the numbers flashed on your screen. Get your healthy dose of medical information and follow our social media platforms. Again, I am Dr. 𝐓𝐡𝐞 𝐃𝐨𝐬𝐿, a nuclear medicine physician from the Department of Radiology. Sa Los Santos Medical Center, we provide you global standards of care with a personal touch. Kalinga ka rito.